Hello, my name is Werner Müller and I'm doing this presentation as part of my Western Governors course, Application of Effective Communication. What would you do if I tell you that taking a small pill like this every day could reduce your risk of getting cancer by up to 34% and substantially reduce the risk of getting a heart attack as well? Studies show that aspirin can have a very positive effect on your health because it can lower the risk of getting cancer and it does lower the risk of getting a heart attack. How can aspirin lower the risk of getting cancer and a heart attack and lower the damage during a heart attack? To start, let's look at how aspirin can reduce the risk of getting a heart attack. First, let me explain to you how heart attacks occur. Heart attacks occur when the blood supply to a part of your heart muscle or brain is blocked. This usually starts with atherosclerosis, a process in which plaque builds up in the inner lining of an artery. The damage occurs when a plaque becomes fragile and ruptures. Plaque that ruptures causes blood clots to form that can block blood flow or break off and travel to another part of the body. Aspirin blocks factors in the blood that cause blood clots to form. Blood clots are good when they stop bleeding. So in this case, when you cut yourself, the blood clots are actually stopping the bleeding, but are harmful when they clog the arteries, leading to the heart or brain and increase the risk of a heart attack and stroke. The following table that you can see here to your right shows the effect of taking low dosage aspirin over a course of 5 years. So if you have a baseline risk of around 5% of getting a heart attack, for 1,000 people over 5 years, 20 heart attacks are getting avoided, which is actually quite significant. I briefly want to talk with you as well about the benefits of taking aspirin during a heart attack. When you have a heart attack, it is very beneficial to immediately take an aspirin after calling 911. The CDC recommends to chew an aspirin rather than swallowing it because chewing will release the ingredients of the aspirin into the blood within 5 minutes versus 12 minutes for swallowing. Aspirin will help unclog the clot and alongside with this reduce the damage the heart is taking during the heart attack. Next, I would like to talk with you about the benefits of aspirin for reducing the chances of getting cancer. A new study published in The Lancet, headed by Professor Peter Rothwell from the University of Oxford, came to the conclusion that the daily suggested intake of low dosage aspirin for at least 5 years can reduce the risk of dying from cancer substantially. Professor Rothwell combined the results from 8 different clinical trials covering 25,000 people, of which 674 people died of cancer. The result showed that people who took a daily low dosage of aspirin, which is defined as at least 75 milligrams, reduced in the first 5 years the overall risk of getting cancer by 14%. And if they took the aspirin for even longer than 5 years, the odds of getting cancer got reduced by 34%. In the graph to my right here, you can actually see this is part of the study, see a variety of areas or cancers where they've shown actually a reduction in cancer with the usage of aspirin. One of the interesting lines here is really around pancreatic cancer. So pancreatic cancer is a fairly nasty cancer, very aggressive, which has a survival rate of only 5% or less after 3 years after getting diagnosed. So when you take actually an aspirin, in the first 5 years, the effect on pancreatic cancer, the reduction of pancreatic cancer, is dropping down to something like 15%, but past 5 years, it actually goes up to 70%, which is quite considerable and a very compelling reason to start actually taking low dosage aspirin. At the beginning of this presentation, I told you that research showed that aspirin can have a very positive effect on your health because it can lower the risk of getting cancer and a heart attack. Considering all the research conducted on usage of low dosage aspirin, you can see that there are some real benefits of taking aspirin on a regular basis. If you're interested in lowering your risk of getting cancer or lowering the risk of heart attack, make an appointment with your doctor and tell him that you would like to start a low dosage aspirin regimen. Your doctor will tell you if the low dosage aspirin regimen is right for you and what some of the potential risks are. Thank you very much for listening to this presentation. I hope that it was informative. Goodbye.